A lot has changed since COVID-19 became a pandemic and spread across the world. Everyone has been affected somehow. For my passion project, I decided to document the interesting time we are in. I interviewed different people with different points of view. Also, I made a slideshow with before and after photos of COVID-19. I'm doing this documentary for school about the COVID-19 pandemic.
Okay.
What is your job?
I'm a courtesy clerk and a sanitation person, so I like do carts and bag, and then I also will clean the store.
What was your job like before the COVID-19 pandemic?
The job was pretty quiet, pretty like slow. It was pretty easy, and after it, was it after?
Yeah, how has your job changed?
And it changed. It's been a lot busier. I've been working a lot more, and just like long days.
Is this pandemic making your job easier or harder?
Definitely harder because so many more people are coming in every day, and then they're just like making a lot more work. I think just because everyone's freaking out and like want to make sure they have everything, so they just keep buying stuff and buying stuff.
Have you seen a change in the customers since the beginning of the pandemic?
Yeah, I feel like customers are more like anxious, and they get angry easier about things because they're more impatient about it.
What is the new COVID-19 protection that you're using?
Gloves, and I also have this mask, and I don't really like wearing them, but you know we have to, so.
What protection / producers will stay in use after the pandemic?
I'm sure probably cleaning the store like routinely every hour will probably stay. I don't know about mask or gloves or anything. I hope that doesn't stay, but it might.
Are you at all afraid of any customers bringing in the virus and getting you sick?
Not really. Just if people don't have a mask on and they like cough or something, that's kind of like a little scary, but like for the most part people are good about it, so.
So being a high school senior and missing out on graduation, how does it make you feel?
Missing out on graduation is kind of sad. It is moved to the summer, but we can only have 2 people. But other than that, it's just frustrating how school ended and everything, because it's not fun. So yeah. Hello, I'm Rachel McMahon. I'm going to be asking you some questions today about your job and COVID-19.
So my name is Dr. Suzanne Lee, and I am a family medicine physician, and I see patients in Utah. We're in an outpatient clinic where that's in a pretty small town, not too far from the border with Idaho.
What was your job like before the COVID-19 pandemic?
So before COVID-19, I was seeing anywhere from 15 to 30 patients in a day, and in my office, and we would see people who were healthy for their well child or well adult exams. We would see people who were sick, who had coughs or fevers or stomach problems. We would see people who had chronic health problems like diabetes or depression or anxiety, and we would see all of those people in my clinic. They would come into the building and check in and sit and wait in our lobby until it was time for them to come back.
How has your job changed during this pandemic?
Well, since the pandemic started, my clinic changed the way that we do visits, and so most of my visits are now over video. So it's called telemedicine or telehealth visits. I don't see 15 to 30 patients a day anymore. Now I see anywhere from maybe 3 to 8 patients in a day, so it's much fewer just because most people aren't coming in or calling for appointments. But we don't have anybody waiting in our lobby anymore. Everybody just waits in their car and has to call ahead so that we can check them for fever before they come in. And I get a check for fever every time I go in to work. Now I wouldn't come into work even if I felt just a little bit sick. And we wear masks in the clinic all day. But I do shut my door when I have a video visit with the patient so that our conversation is still private. And I take off my mask to be able to have that, because it would be hard to talk to a patient if I was sitting there wearing my mask like this. That would be hard for them to know if I was smiling or if I was angry.
Mm-hmm.
I just take off my mask when I'm on the video.
What would happen if a patient had a fever when you got them checked?
Yeah. So if somebody has a fever, then we would say, let's make your visit be a telemedicine visit instead of an in-person visit. And if they are sick with those kinds of symptoms, then we don't want them to come into our clinic. We just want to be able to talk with them over the phone. Even though I'm not able to put my stethoscope on their chest or on their back, just by talking to them, I would be able to tell if they seemed like they were so sick that they shouldn't stay home, if they were so sick that they needed to go be checked in an emergency room or somewhere where they are able to see patients who might have COVID-19. If there's somebody who's got a cough and they've got a fever, but they're not so sick that they necessarily have to go into the emergency room or anything like that, then we would say, hey, probably it was good for you to rest at home. And another thing that we're doing here in Utah is we're making sure that anybody who's got a symptom of COVID-19, if it's a fever or a cough or a sore throat or anything like that, then they can get a test done for COVID-19, and they're welcome to do that. We don't have restrictions now as far as how old you have to be or how sick you have to be, or if you're having to go to the hospital. Really, at this point, anybody who has any symptoms of being sick can go to one of the testing centers.
Do you work from home or at the office? And what can you do from home?
So I am the only medical provider in my particular clinic location, and so I go into the office to work. There are doctors within my clinic system who work at other locations, and because there might be 5 or 10 or 15 doctors who all work in that place, then they might designate a day where Dr. Smith is going to be the in-clinic doctor on Monday and Dr. Jones is going to be the in-clinic doctor on Tuesday, and they make sure that every location has at least one provider there at all times that the clinic is open, and their other doctors can work from home and do patient visits from home.
Have you seen any patients that you thought had the coronavirus?
I have. I had a patient who was concerned about a rash that they had on their foot. There was a funny little rash with little kind of reddish, purplish, blistery bumps. And a lot of viruses cause rashes, so it's not that surprising that coronavirus can cause rashes in some people. This patient did not want to go get tested, partly because they didn't feel sick, partly because they couldn't think of any reason that they would have been exposed to it. And partly, I think, because if they had tested positive, then even though they didn't have any symptoms, they would not have been able to continue going to work. And
are you scared of catching coronavirus being a doctor?
I think that for me, it's probably more likely that I would catch coronavirus from somewhere outside of my medical practice at this point because of all the precautions that we're taking. So we're doing this interview today, May 15th. And if you asked me that same question, say in August, maybe things have opened back up. Maybe my clinic is more busy with in-person people coming and going. And if you asked me that same question in August, I would say, yeah, I think I could get this from my work as a doctor. I've been a healthy person up until now. We know that even people who are healthy can still get really, really sick from coronavirus.
Should people avoid going to the doctor for other reasons right now?
You know, that's a very good question. We've been trying to figure that out on a case-by-case basis with pretty much everyone who has been in touch with our clinic. So for people who need to have care for their chronic conditions, then if somebody has been pretty stable on all the medicines that we've been doing and all the treatments they've been getting, and instead of making sure that they have a follow-up visit with me every 3 months or every 6 months if they're due for that, for some of these folks, I'm saying, hey, I'm just going to refill your medicine for now and let me know if there's a problem either with a video or a phone call. There's a lot of things that we can take care of over the phone or over a video visit. People should not delay getting medical care if they have symptoms that are starting to feel really serious and really bad, because coronavirus is not the only dangerous thing out there. And people are very happy to help them out with that over the phone and over video, just to say like, hey, you know what, you really do need to come in and get checked.
Thank you again for sharing.
You're welcome. Thank you, Rachel. Bye-bye.
Hello, I'm Rachel McMahon, and today I'm going to be interviewing you about COVID-19.
Okay, I'm in.
Okay.
My job? I'm a co-owner of the shop that you are currently in. It's Free Agent Sports here at Paradise Valley Mall. We sell sports collectibles. As you can see, there's a ton of sports nonsense all over the place. Before the COVID-19 pandemic, we were a shop having a pretty good run selling Kansas City Chiefs merchandise. They just won the Super Bowl. It was a typical year. It was post Super Bowl where sales are good and business is good.
How has your job changed during this pandemic?
During this pandemic, how have things changed? Well, we had to close our store, as most retail establishments did, and I wanted to stay open as long as possible, but our last day open was March 28th, and then following March 28th, we shut down and we reopened just this past weekend.
How has this pandemic impacted your business?
Well, being shut down for 6 weeks was no fun. That brought us a grand total of $0 to the store. However, something that I did not anticipate with COVID, people are really missing their sports, and they really like their sports collectibles, and especially in cards. The prices of nearly every product that I have has gone up in the last 2 months.
Do you do anything from home?
I hadn't sold from home in quite a long time, but just because of COVID, when the store was shut down, I did put a lot of items up on the internet and business was booming. April 2020 was one of my best online months ever.
Since you reopened your store last week, have there been lots of customers?
Yes. With social distancing, we had a lot of people in the store, and we were able to maintain crowd distance and everything like that. We were safe, but we had a real good turnout when we had a reopening this past weekend.
Are you afraid of coming in contact with a person who has COVID-19?
Anything is possible. Just like I have been working in a mall for the last 20 years, so I'm sure I've encountered people who have all kinds of viruses and all kinds of sicknesses. I feel confident in my ability to fight off infections and sicknesses. This is a new one. This is a more powerful one. But as long as I'm being conscious of it and being careful, I'm not worried about receiving the virus.
Thank you. That will be all for this interview.
Yeah, thank you.
Thank you very much, Rachel.
You're welcome. I then interviewed my grandfather. He had been in the hospital for something else not related to COVID-19. Here's a summary of what I learned. I wanted to know what it was like to be in a hospital during the pandemic. I asked him about his experience. My grandpa spent 6 days in the hospital. He said that for the most part it was not very different from other times he had been in the hospital. The biggest difference was that he could not see anyone. Not even my grandma could go see him. The nurses and the doctors were the only people he could see. My grandma said that the hardest thing for her was that she could not meet with the doctors and talk to them about what's happening with her husband. So what is your job?
I am a pediatric dentist at Desert Kids Dentistry, and my name is Dr. Stephen Petruzzi.
How has your job changed since COVID-19?
So we've changed a little bit. We've always done, masks during treatment and things and taken extra precautions to clean the treatment area and things like that. But we have changed. I always wear a mask now in patient situations, whereas I used to just do it when I was working on the kid, and then I'd take it down. We take extra precautions as parents come in and kids come in. We wear extra protection for ourselves and just extra precautions, but it really hasn't changed too much because we were already doing a lot of infection control procedures.
Mm-hmm.
Is it harder or easier to do your job with the extra precautions?
It's harder. It's definitely harder. There's more things we have to wear to protect ourselves, so it gets hotter, so we have to crank the air down more. There's just breathing in the mask hurts more pressure on my ears. It takes longer to get patients screened so that everyone's safe. So we have to space patients out more. So it's definitely harder. Definitely harder.
What do you think will stay? Like, what procedures will stay?
I think some of the extra infection control things we do will stay. To be honest, I think we'll probably take temperatures. It's an easy, 2-second thing, and kids sometimes don't know. I mean, my kids had 102 fever and they were running around playing, no problem. Adults a little bit different. You have a little bit of fever, you don't feel good. But kids, sometimes they don't know, and it's an easy screening tool where we can just say, you know what, you're sick, go home. The difference is that everything in dentistry creates an aerosol unless you're just doing an exam, and that's all I did. That's why I'm not gowned up. But brushing teeth, drilling on teeth, filling teeth, everything creates more aerosols in the air, where you have spit kind of flying through the air is what an aerosol is. So we take extra precautions with that. We have high-speed suction that will suck a lot of that air out. I'm looking into getting some more just air filters, which will kind of pull some more of those aerosols out of the air sooner. And then, aerosols fly through the air. You may wear a mask, helps protect against that. This isn't an N95, but it's better than not having anything on, and it does catch a lot of that stuff. So,
Thank you for letting me interview you.
yeah, no problem.
Stay safe, stay healthy, and thanks for watching.